Exosome treatment for osteoarthritis. Millions of people worldwide suffer from osteoarthritis, OA, a degenerative joint condition that causes pain, stiffness, and decreased mobility. While they have major drawbacks, conventional therapies like medication, physical therapy, and surgery can provide varying degrees of relief. Exosome treatment has currently gained attention as a potentially more effective and minimally invasive osteoarthritis treatment. Osteoarthritis treatment with exosome treatment involves isolating exosomes from the mesenchymal stem cells, MSCs, and injecting them into the affected joint area. By doing this, the exosomes deliver the bioactive molecules that help reduce inflammation, promote cartilage repair, and enhance tissue regeneration. It offers a minimally invasive alternative for improving joint function and alleviating pain.